If your blood sugar is higher early in the morning than it was the night before, I need you to stop for a moment. Do not skip past this because what I'm about to explain may completely change how you understand type 2 diabetes, insulin resistance, and your own body. And before I even start, I want you to notice something right now. Notice how tired you have been feeling after meals lately. That heavy, foggy feeling that settles in about 30 minutes after you eat. Notice how your energy drops hard around the same time every single afternoon, almost like clockwork. Notice how your cravings feel stronger and more urgent than they did even 5 years ago. And notice how your waistline has been slowly shifting, even when your habits did not feel dramatically different. Most people write those things off as separate problems: aging, stress, not sleeping enough, maybe just bad luck. But they are not separate, they are connected. And according to emerging metabolic research, one of the biggest hidden drivers behind all of these things may be something your doctor barely spent 2 minutes on during your last checkup. Not sugar intake, not carbohydrates, not age, vitamin D deficiency. And here is what makes this story so important. Vitamin D is not just a bone vitamin. It influences insulin resistance, blood sugar control, inflammation, pancreatic function, and overall metabolic health in ways that most people have genuinely never had explained to them clearly. And I am going to change that today because one of the studies I am going to walk you through later in this video completely reshaped how many researchers now think about metabolic disease itself. Not a small finding, a major shift. So stay with me because this gets very interesting. I am Dr. Megan Foster, and for over 24 years, I have worked directly with patients dealing with obesity, inflammation, insulin resistance, metabolic syndrome, and type 2 diabetes. Thousands of patients, real people with real lab results and real daily struggles. And one thing I learned very early in that work is this: the explanation most people hear about blood sugar is incomplete. People are told their body is simply bad at handling sugar. They are told to eat less of it, take their medication, and manage from there, but that is not the full picture. Type 2 diabetes is not simply a sugar problem, it is a signaling problem. It is a metabolic communication breakdown happening across multiple systems in the body simultaneously. And when you understand it that way, it changes everything about how you approach it. Now, here's where vitamin D becomes genuinely fascinating. Vitamin D receptors are found in nearly every major system involved in that metabolic process: your pancreas, your muscle tissue, your immune system, your liver, even the cells directly responsible for insulin sensitivity. That means vitamin D is doing far more than helping your bones stay strong. It behaves like a metabolic control signal, a hormone like messenger that participates in the regulation of glucose, inflammation, insulin production, and cellular communication throughout the entire body. And when vitamin D levels stay low long enough, the body can slowly drift into metabolic dysfunction without the person ever realizing what is actually happening. That is the piece most people never hear. Now, let me give you one more layer to this that I think is going to genuinely surprise you. Most people assume vitamin D is a vitamin. That is right there in the name. But technically, biologically, it is not quite a vitamin at all. Vitamins are nutrients the body cannot produce on its own. You have to get them entirely from food or supplements, but vitamin D is different. The body actually manufactures it when sunlight hits the skin. That makes it function more like a hormone than a traditional vitamin. And hormones are signaling molecules. They carry instructions to cells all over the body. This is exactly why vitamin D has receptors in so many different tissues. It is not just delivering a single message to one system, it is delivering coordinated signals across dozens of systems simultaneously. And here's what that means for blood sugar specifically. When vitamin D levels drop, it is not like running out of one ingredient in a recipe. It is more like losing a conductor from an orchestra. Every instrument is still there, the musicians still know their parts, But without that central coordination signal, the timing goes off. The whole performance becomes less precise. And over time, that imprecision builds into something you actually feel in your body. That heaviness, that afternoon fog, that stubborn glucose that will not cooperate. This is also why so many people feel the effects of low vitamin D across multiple areas of health at the same time. It is not coincidence. It is one signal affecting many systems simultaneously. Let me put the blood sugar connection into perspective with some real research numbers because I want you to understand just how significant this is in the data. Large scale population studies involving tens of thousands of participants have consistently found that people with lower vitamin D levels have a measurably higher risk of developing type 2 diabetes over time. One major analysis that looked at data across multiple countries found that individuals in the lowest range of vitamin D had roughly a 40% higher risk of developing diabetes compared to those with adequate levels. 40%. That is not a small margin. Other research has found that for every 10 nanogram per milliliter increase in circulating vitamin D, insulin sensitivity improves in a measurable and statistically significant way across different populations. And a well designed clinical trial from Tufts University looked specifically at people who already had prediabetes, meaning they were at high risk of developing full type 2 diabetes. The participants who received vitamin D3 supplementation showed a meaningful reduction in the rate of progression to diabetes compared to those who did not. Now, none of this means vitamin D is a magic solution, but it does mean the relationship is real, it is measurable, and it is large enough to matter clinically. And this is the part that genuinely frustrates me as a physician. These findings have been building in the research literature for well over a decade. Yet the average appointment where someone is diagnosed with prediabetes or type 2 diabetes still rarely includes a vitamin D level check. That gap between what the research shows and what actually happens in practice is one of the main reasons I make these videos. Let me put all of this into a personal perspective now because I think making the science relatable is just as important as explaining the science itself. Think back to how your body felt several years ago. Maybe you could eat a heavier meal and still wake up feeling rested and energized the next morning. Maybe you did not need caffeine to function by 11 in the morning. Maybe your hunger felt more predictable and manageable. Maybe your weight stayed relatively stable without obsessing over every single thing you ate. And now, you skip dessert and your blood sugar still climbs. You try to eat cleaner and your energy still crashes. You wake up tired even after what should have been a full night of sleep. Your belly, specifically around the middle, feels almost impossible to shift no matter what you try. And over time, people start to accept this. They start to believe this is simply what getting older feels like. But here is what I need you to hear clearly. Many times, what people call aging is actually metabolic dysfunction building quietly in the background over years. And those are very different things. One you cannot change, the other you absolutely can address. This was not necessarily inevitable. Your body was not designed to become progressively more inflamed, more exhausted, more insulin resistant, and more metabolically unstable with every passing year. That is not the natural blueprint. The body adapts to the environment it is placed in. When critical metabolic signals begin breaking down, including the nutrient signals we will talk about today, the entire system starts struggling to keep up. But here is the other side of that. When those systems are properly supported, many people notice improvements they were not expecting, not overnight, not from a single supplement or one dramatic lifestyle change, but gradually. Steadier energy through the day, fewer hard crashes after meals, more stable hunger, better glucose control over weeks and months. That is why understanding the root environment matters so much. And that is exactly what we are going to dig into today. Let me start with a simple explanation of what insulin resistance actually is, because once you truly understand the mechanism, everything else in this video will make much more sense. Imagine insulin as a key. Your cells are like doors that need to be unlocked before glucose can get inside and be converted into energy. In a healthy system, insulin acts like a perfectly fitting key. It slides into the lock, the door opens, glucose enters the cell, and your body has the fuel it needs to function. But here's what happens over time when chronic inflammation, poor sleep, sedentary habits, and nutrient deficiencies build up in the background. Inflammation acts like rust forming inside the lock. The key is still there. The insulin is still being produced, but the door stops responding to it properly. The signal becomes weaker and weaker. Glucose cannot enter the cell as efficiently, so it stays trapped in the bloodstream longer than it should. And the body's response to that? The pancreas works harder. It produces more insulin, trying to force that same response, more and more of it, just to get the same result. That creates a cycle. More insulin production leads to more cellular stress. More stress leads to more inflammation. More inflammation leads to more resistance. And around it goes. Now, here's something most people do not realize about this cycle. High insulin levels themselves cause problems that go far beyond blood sugar. When insulin is chronically elevated, the body reads that as a signal to store fat, specifically to store it around the abdominal organs. That is the belly fat that so many people with insulin resistance struggle to lose. But it is not just excess energy sitting in an inconvenient place. The deep fat around the abdominal organs is itself metabolically active. It releases inflammatory signals of its own, it disrupts hormonal balance, and it adds to the overall inflammatory load that makes insulin resistance progressively worse. So the cycle runs in multiple directions at once. High blood sugar leads to more insulin. More insulin leads to more abdominal fat storage. More abdominal fat leads to more inflammation. More inflammation leads to worse insulin resistance. And the blood sugar climbs higher. This is why insulin resistance tends to get progressively worse if the root environment is not addressed. It is not a static condition, it is a moving, self amplifying process. And this is also why understanding what actually breaks that cycle at its root is so important. Not just managing the blood sugar number from the outside with medication alone, but actually addressing the signaling environment that is driving it from within. That is where vitamin D becomes directly relevant. Vitamin D appears to help maintain the sensitivity of those cellular locks. It supports the body's ability to respond to insulin signals properly. And beyond that, it works simultaneously on inflammation, immune regulation, pancreatic function, and liver signaling. This is not a simple, one dimensional relationship, it is a multi system connection. And that is exactly why researchers have become so focused on it. Not because it is a trend, because the biology keeps pointing in the same direction. Before I get into the specific mechanisms, I want you to know what we are covering in this video. I am going to walk you through the 5 most important ways vitamin D may support healthier blood sugar regulation. And the final one, which I am saving for last, is something that even people who are already taking vitamin D supplements are almost always missing. It may be the single biggest reason so many people take this vitamin for months and feel absolutely no difference. So make sure you stay through the final section. It ties everything together. And before we go further, if you've been noticing changes in your energy, your cravings, or your blood sugar over the last few years that felt difficult to explain, drop a comment below and tell me what you have been experiencing. One of the most valuable things about this community is realizing how many people are quietly going through the same things without talking about it. Now, let us get into the mechanisms. The first one is inflammation. And I want to reframe how you think about it because most people assume inflammation only matters when something hurts, a sore joint, an injury, a skin flare up. But chronic, low grade inflammation, the kind that does not announce itself loudly, is one of the most significant and underappreciated drivers of insulin resistance. Here is why. When inflammation is present throughout the body on a sustained basis, it directly disrupts the communication pathways that insulin depends on. The cellular signaling becomes noisier and less precise. The insulin response slows. Glucose regulation deteriorates. There's a specific protein in the body called TNF alpha. I know that sounds technical, so let me simplify it. It is essentially an alarm signal the immune system sends out when it senses a threat. In short bursts, it is protective. But when it stays elevated chronically because the body perceives a constant low level threat from inflammation, it physically blocks the insulin receptor pathway inside cells. It gets in the way of the lock mechanism we talked about. Research has shown that vitamin D actively reduces the production of TNF alpha and several other inflammatory proteins that interfere with insulin signaling. This is a specific, documented molecular pathway, not a vague association, a real mechanism. Vitamin D has also been shown to increase the production of a hormone called adiponectin. This is produced by fat tissue, and it actually improves insulin sensitivity and reduces inflammation when levels are adequate. People with type 2 diabetes and metabolic syndrome consistently have lower adiponectin levels, and research has shown that vitamin D supports its production. So, when we talk about vitamin D and inflammation, there are specific molecular pathways connecting them that the research has actually mapped out. And this matters enormously in practice because one of the most common mistakes I see is people focusing on supplementation while doing nothing to reduce the habits that constantly refuel inflammation in the first place. Poor sleep is one of the largest drivers of systemic inflammation that most people significantly underestimate. Even 2 or 3 nights of genuinely poor sleep can measurably change inflammatory markers in the blood and worsen insulin sensitivity in ways that take days to fully recover from. Chronic stress is another major driver. Stress hormones, particularly cortisol when elevated over long periods, directly promote inflammatory responses throughout the body. For many people, this is one of the central drivers of their metabolic problems, and it is one of the least addressed. Ultra processed foods that are high in refined seed oils, artificial additives, and refined carbohydrates create repeated waves of inflammation after every meal. Not because eating them once is catastrophic, but because eating them consistently across months and years creates a sustained inflammatory state that the body cannot fully recover from between episodes. And physical inactivity compounds all of it. Movement is genuinely anti inflammatory. Muscle contractions release signaling molecules that help reduce inflammatory load throughout the body. When people are sedentary for extended periods, a chronic low grade inflammatory background accumulates that makes every other metabolic process harder. So, when we talk about vitamin D and inflammation, the supplement matters, but the environment matters just as much or more. Addressing the root habits that keep inflammation elevated is what allows the vitamin D support to actually work. Now, let us talk about the pancreas. And I want to go a little deeper here than most people ever hear. Your pancreas contains cells called beta cells. These are the cells responsible for producing insulin. When blood glucose rises after a meal, these beta cells sense the change and release insulin in response. But here's something most people do not know about beta cells. They are uniquely sensitive to something called oxidative stress. Oxidative stress is essentially the cellular equivalent of rust. It happens when unstable molecules called free radicals build up faster than the body can neutralize them. And beta cells have unusually low natural defenses against this kind of damage compared to most other cells in the body. This is not a design flaw. Beta cells were never designed to be constantly overworked. But in a modern environment where blood sugar is repeatedly spiking throughout the day, where inflammation is chronically elevated, where sleep is disrupted, And where nutrient deficiencies are common, these cells are under a level of sustained stress they were not built to handle indefinitely. Over time, that stress reduces their ability to produce insulin accurately. And in more advanced cases, it can actually reduce the total number of functioning beta cells the pancreas has available. Here's the important connection. Vitamin D receptors exist directly inside these pancreatic beta cells, not nearby, inside them. Researchers believe this is functionally significant because vitamin D has antioxidant properties that may help protect these vulnerable cells from oxidative damage. Some research has shown that vitamin D supports the production of specific protective enzymes inside cells that defend against free radical damage. So, vitamin D does not just affect how cells respond to insulin, it may also play a role in protecting the very cells that produce it in the first place. Some clinical research has shown that people with adequate vitamin D levels tend to have better preserved beta cell function compared to those with significant deficiencies. The consistent pattern in the data is difficult to ignore. And here's the clinical reality I have observed across many years. People often wait until significant dysfunction has already developed before anyone starts looking at foundational deficiencies. By the time the lab work clearly shows a problem, the system has often been struggling quietly for years. Addressing deficiencies earlier, before dysfunction becomes severe, is a far more powerful position to be in. Now we are moving into the mechanisms that directly affect how your body handles glucose day to day. This is where it starts connecting directly to how you feel every single hour. Let us talk about insulin sensitivity in muscle tissue, because this is one of the areas researchers focus on most intensively, and it is something most people genuinely do not know. Your skeletal muscle, the large muscles throughout your body, is responsible for absorbing roughly 80% of the glucose that enters the bloodstream after a meal. That is an enormous proportion. Most people think of the liver or the pancreas when they think about blood sugar, but the muscles are doing the heaviest lifting when it comes to actually clearing glucose from the blood after you eat. And in insulin resistance, that process is impaired. The muscle cells become less sensitive to the insulin signal. They absorb glucose more slowly. Blood sugar stays elevated longer. The pancreas compensates by producing more insulin. And the metabolic stress compounds. Vitamin D appears to influence insulin receptor sensitivity specifically within muscle tissue by supporting a system called GLUT4 transport. GLUT4 is a protein that physically moves glucose from the bloodstream into the muscle cell. Think of it as a glucose doorman. Insulin is the signal that tells the doorman to let glucose in. And research suggests vitamin D supports the ability of that doorman to respond to insulin's signal effectively. What this looks like in practice for many people is gradual but noticeable. Less of a hard energy crash after meals, more stable appetite, less of that heavy, foggy, drained feeling in the afternoon, more consistent energy from morning through early evening without the dramatic swings. Not because the body became perfect overnight, but because the signaling system is functioning more efficiently. The communication is clearer. Now, I want to talk about something that often surprises people when they first hear it. The relationship between vitamin D and blood sugar is not only about what happens after you eat, it also affects what happens while you are sleeping. One of the most common patterns I see in patients with metabolic struggles is elevated fasting blood glucose. That means the blood sugar reading first thing in the morning before eating anything is higher than it should be. This is often driven by what is called the dawn phenomenon. In the early morning hours, the body begins preparing for waking by releasing hormones like cortisol and growth hormone. These hormones are natural and necessary, but as a side effect, they signal the liver to release stored glucose into the bloodstream to give the body fuel for the day ahead. In a metabolically healthy person, this release is moderate and cells clear it efficiently. But in someone with insulin resistance and low vitamin D, two things go wrong simultaneously. The liver releases more glucose than necessary because cortisol signaling is less well regulated. And the cells cannot clear it quickly enough because insulin sensitivity is impaired. The result is that the person wakes up with a blood sugar reading that is actually higher than it was when they went to bed the night before. Vitamin D's role in liver signaling and glucose regulation appears to be relevant here as well. Some research has observed improvements in fasting glucose, specifically in people who corrected significant deficiencies. This is also one reason why addressing vitamin D cannot be separated from addressing sleep quality. Sleep is when the body does its deepest metabolic regulation and repair. Hormones recalibrate, inflammatory signals clear, tissues recover. When sleep is poor or insufficient, morning glucose almost always suffers. And vitamin D plays a role in sleep regulation too. Vitamin D receptors are present in areas of the brain involved in sleep architecture, specifically in regions that regulate the transitions between different sleep stages. Low vitamin D levels are consistently associated with shorter sleep duration and more disrupted sleep quality across multiple studies. So there's a cycle here worth understanding clearly. Low vitamin D may impair sleep quality. Poor sleep worsens insulin resistance. Worse insulin resistance elevates morning glucose. Elevated glucose promotes inflammation. Inflammation interferes with vitamin D metabolism, and the whole loop reinforces itself. Breaking that cycle requires addressing multiple parts of it simultaneously. That is why this is never about just taking one supplement and expecting transformation. It is about supporting the full system. Let me take a moment here to address something important because I want to be completely honest with you about what the research does and does not say. Vitamin D is not a cure for type 2 diabetes. It is not a replacement for medication for people who genuinely need it. The metabolic system is extraordinarily complex, and no single nutrient resolves a complex multi system dysfunction on its own. What the research consistently shows is that vitamin D deficiency is strongly associated with worse metabolic outcomes, and that correcting significant deficiencies is associated with measurable improvements in insulin sensitivity, inflammatory markers, fasting glucose, and beta cell function in many people. That is meaningful. That is worth taking seriously. But it sits within a broader context. More vitamin D is not always better. Vitamin D is fat soluble, meaning the body stores it rather than flushing excess amounts out the way water soluble vitamins are handled. Taking very high doses without monitoring can lead to toxicity over time. The optimal range from a metabolic health perspective tends to fall between 50 and 80 nanograms per milliliter based on current research. Many people are functioning well below that range without realizing it. The most useful first step is to have your vitamin D level actually tested. A simple blood test gives you a real number to work with. From there, supplementation can be targeted and appropriate rather than guesswork. And this is not about abandoning your medical care. For many people managing type 2 diabetes or prediabetes, this works best as one component of a broader support strategy alongside whatever your doctor has recommended. Now, let us talk about the broader strategy in real practical terms, because the research on metabolic health increasingly points toward a cluster of interconnected factors that all influence each other. Addressing them together produces far better results than trying to address any one of them in isolation. Sleep, we have already discussed. Getting consistent sleep between 7 and 9 hours in a properly dark, cool environment is one of the most powerful metabolic interventions available. If sleep is chronically disrupted, every other effort becomes significantly less effective. Movement is another foundational piece. And I do not mean intense exercise necessarily. Even consistent walking, particularly after meals, has a measurable impact on blood glucose clearance. Here is something most people do not know about the timing of movement. Research has shown that muscle contractions, even light ones like walking, can activate GLUT4 glucose transporters independently of insulin. meaning the muscles can absorb glucose directly, even when insulin sensitivity is impaired, simply in response to movement. The muscles have a secondary glucose uptake system that bypasses the insulin signal entirely, and walking activates it. This is one of the most practically useful pieces of information I can give you. Moving after you eat is not just generally healthy, it is specifically and mechanistically helpful for blood sugar in a well documented way. Even 10 to 15 minutes of walking after dinner can produce a noticeable difference in post meal glucose readings for many people. Sunlight exposure is worth discussing specifically because it is the most natural way for the body to produce vitamin D, and the body self regulates how much it makes from sunlight. So there is no real risk of overproduction from sun alone. About 15 to 30 minutes of midday sun exposure on a meaningful amount of skin, arms, legs, abdomen, several times per week during warmer months can significantly support vitamin D status. This is particularly important for people who spend most of their time indoors, live at higher latitudes, or have darker skin that requires longer exposure for the same synthesis rate. Nutrition quality matters enormously here, not in an extreme or restrictive way, but in terms of consistently moving away from the foods that constantly drive inflammation and glucose dysregulation. And I want to say something specific about dietary fiber that does not get nearly enough attention in these conversations. Dietary fiber, particularly from vegetables, legumes, and whole grains, does something very important for blood sugar. It slows the rate at which glucose is absorbed from the digestive system into the bloodstream. This reduces and flattens the blood sugar spike that follows a meal. Over time, consistently including fiber at meals is one of the most straightforward and well supported strategies for improving post meal glucose control. Fiber also feeds the beneficial bacteria in the gut, which produce compounds called short chain fatty acids that reduce systemic inflammation and improve the gut's ability to regulate blood sugar signaling. And here is something about the gut that most people in blood sugar conversations have never heard. The gut lining itself contains cells that produce hormones involved in blood sugar regulation. One of the most important is called GLP-1, which stands for glucagon like peptide 1. This hormone signals the pancreas to produce insulin after eating and also slows the rate at which food leaves the stomach, which naturally reduces blood sugar spikes. The gut microbiome significantly influences how much GLP-1 is produced, and a diet with consistent fiber from whole food sources is one of the primary ways to support the gut bacteria that stimulate GLP-1 release. This connection between gut health and blood sugar regulation is an area of research that is growing very rapidly. And what it keeps pointing toward is that metabolic health is inseparable from the health of the gut environment. Eating more fiber from real whole food sources is genuinely one of the simplest and most affordable things most people can do to support both simultaneously. Stress management, as I mentioned earlier, is something many people intellectually understand matters but consistently underestimate in practice. When cortisol is chronically elevated, it directly raises blood glucose by signaling the liver to release stored glucose. It promotes abdominal fat storage, and it disrupts sleep, which worsens everything else. Simple practices repeated consistently, whether that is a short walk, a few minutes of slow breathing, time away from screens before bed, or whatever genuinely works for you, can meaningfully reduce the baseline stress load that is quietly undermining your metabolic progress. Now we are getting to the final and most overlooked mechanism, the one I told you about at the beginning. And honestly, this is the piece that changes the conversation for many people: magnesium. Many people take vitamin D consistently for months or even years and feel essentially nothing. No change in energy, no improvement in sleep, no difference in glucose levels. And they eventually conclude that the vitamin D is simply not working for them. But in a significant number of those cases, the issue is not the vitamin D itself. The issue is that they are magnesium deficient. And without adequate magnesium, vitamin D cannot be properly activated in the body. Magnesium is required as a cofactor in the process that converts vitamin D from its inactive storage form into its biologically active, usable form. Without enough magnesium, that conversion does not happen properly. Vitamin D from supplements or sun exposure essentially sits in the body inactive, unable to reach the receptors throughout the metabolic system that need it. Research estimates that somewhere between 50 and 80% of people in modern populations are not getting adequate magnesium. The reason is not complicated. Magnesium is found primarily in leafy green vegetables, nuts, seeds, legumes, and whole grains, all foods significantly underrepresented in the typical modern diet. And intensive farming practices have reduced the magnesium content of soil over decades, meaning even people who do eat these foods may be getting less than they historically would have. But here's the part that surprises most people. Magnesium deficiency on its own is independently associated with insulin resistance, not just as a cofactor for vitamin D, as a direct metabolic problem in its own right. Magnesium is required for the function of over 300 chemical reactions in the human body. A significant number of those reactions are directly involved in glucose metabolism. Magnesium is needed for the enzymes that break down glucose inside cells. It is needed for proper insulin receptor function. And it is needed for the regulation of the channels that control how glucose enters cells in the first place. So, when magnesium is low, blood sugar regulation becomes harder from multiple directions simultaneously. And when magnesium is low and vitamin D is being taken, the vitamin D cannot even be activated to help. This is one reason some people take vitamin D for a year and feel absolutely nothing change. The missing piece was never the vitamin D itself. It was the magnesium needed to make it work. This is also why many practitioners who work deeply in metabolic health now look at several nutrients together rather than in isolation. Vitamin D3, which is the most bioavailable supplemental form, works most effectively when magnesium is adequate. Vitamin K2 is another important piece. K2 helps direct calcium properly in the body, which matters because vitamin D increases calcium absorption. Without K2, there's a legitimate concern about calcium being deposited in blood vessels and soft tissue rather than in bone where it belongs. D3 and K2 work together in a far more coordinated and physiologically safe way than D3 alone. Think of it as a three-legged stool: vitamin D3, magnesium, and vitamin K2. If any one of those legs is missing or too short, the whole structure is unstable. You can take generous amounts of vitamin D3 and see minimal benefit if magnesium is low and cannot activate it. You can correct both D3 and magnesium, but without K2. You may be increasing calcium absorption without directing it safely. All three work together as a system, and this is the complete picture that explains why so many people get disappointing results from isolated supplementation. It was never meant to work in isolation. Now, I want to mention one more thing that is genuinely important and that most conversations about blood sugar and supplements completely skip over. Many people who are working on blood sugar and insulin resistance are also taking metformin, which is one of the most commonly prescribed medications for type 2 diabetes. And here's something important to know. Metformin, while highly effective for managing blood sugar, has been shown in research to deplete vitamin B12 over time. It does this by interfering with how the gut absorbs B12 from food. B12 depletion can cause fatigue, nerve tingling in the hands and feet, memory difficulties, and mood changes. And because these symptoms can look similar to some symptoms of diabetes itself, or simply of getting older, they are frequently missed or attributed to the wrong cause entirely. If you are taking metformin and have not had your B12 level checked recently, that is worth bringing up with your doctor. I mention this not to alarm anyone about a medication that genuinely helps many people, but because understanding how medications interact with nutrient status is part of the complete metabolic picture. Managing blood sugar well over the long term means looking at the whole system together. What the medication is doing, what nutrients may be affected, what other deficiencies may be present, all of it together. This is the kind of comprehensive thinking that produces the best long term outcomes. Let me talk now about testing and practical implementation because I want this to be genuinely useful rather than just theoretically interesting. Getting your vitamin D level tested is straightforward. It is a standard blood test called a 25 hydroxy vitamin D test. Most primary care physicians can order it. The conventional lower limit is often listed around 20 nanograms per milliliter. But from a metabolic health perspective, many researchers and clinicians now argue that optimal levels are considerably higher, in the range of 50 to 80 nanograms per milliliter. What this means in practice is that you might receive a result showing you are technically not deficient by the old standard, while still being at a level that the research associates with worse metabolic outcomes. This is worth a direct conversation with your healthcare provider. Bring your number, ask what optimal looks like for metabolic health specifically, not just bone health. That distinction matters. For supplementation, the doses that have shown benefit in research for metabolic outcomes typically range from 2,000 to 5,000 international units of vitamin D3 daily, often alongside 100 to 200 micrograms of vitamin K2 as MK7, which is the most bioavailable form. For magnesium, forms like glycinate or malate tend to be the most well tolerated and well absorbed. Magnesium oxide, which is very commonly found in cheaper supplements, is poorly absorbed and frequently causes digestive discomfort without delivering meaningful benefit. It is worth checking what form you are actually taking. Most adults would benefit from 300 to 400 milligrams of elemental magnesium daily from both diet and supplementation combined. Practical dietary changes to improve magnesium status include regularly eating dark leafy greens like spinach and Swiss chard, almonds, cashews, pumpkin seeds, black beans, and whole grains like oats and brown rice. None of these are exotic or expensive. They are foods that can realistically be incorporated into most eating patterns gradually and consistently. And now, the practical challenge I want to leave you with. For the next 30 days, I want you to use your body as a genuine feedback system. Pay close attention to the signals it is already sending you. How is your morning energy? Do you wake up rested or already depleted before the day begins? How does your energy behave after meals? Does it hold steady or crash hard within an hour or two? Watch your cravings. Are they manageable or urgent and constant throughout the day? If you can, check your fasting blood glucose in the morning and write it down. Track it over several weeks. Patterns reveal things that single readings cannot. Get outside during daylight, particularly midday, with some skin exposed when the weather allows. Even 10 to 15 minutes consistently makes a real difference over time. Move after meals when you can. Even a short walk is mechanistically and specifically helpful for blood sugar in a way that most people underestimate. Improve your sleep timing. A consistent bedtime and wake time, even on weekends, helps regulate the hormonal rhythms that govern so much of your metabolic function. Add more fiber to your meals from real whole food sources. Make it consistent rather than occasional. And if appropriate for your situation, talk to your doctor about checking your vitamin D level, your magnesium status, and if you are on metformin, your B12 level as well. Bring real data to that conversation and ask for specific numbers, not just a pass or fail result. Small changes done consistently and patiently create real biological shifts over time, not dramatic changes from a single week of effort, but genuine metabolic recalibration that builds meaningfully across months. That is how biology actually works. Now, I want to leave you with something that I genuinely believe matters, not just medically, but personally. If you have been struggling with fatigue, with cravings you feel like you cannot control, with blood sugar that refuses to cooperate no matter what you try, with weight that accumulates around your middle despite your best efforts, I want you to hear this clearly. That is not a character flaw. It is not weakness. It is it is not a failure of discipline or willpower. Your body is responding to its biological environment, to the signals it is receiving, to the support it has or has not been given, to the nutrients that are present or absent, to the sleep it is or is not getting, to the inflammatory load it is constantly managing. Biology responds to biology. And many people have spent years, sometimes decades, blaming themselves for problems that were far more complex than anyone ever explained to them clearly. They were told to eat less and move more, handed a prescription, and sent home without being given the complete picture of what was actually happening inside their own body. That is not good enough. You deserve to understand the mechanism. You deserve to have the complete picture. Not so that you feel overwhelmed by complexity, but so that you can stop blaming yourself for things that were never simply about personal failure and start addressing the actual root environment your body is operating in. When people finally understand how the metabolic system actually works, something important shifts. Fear starts being replaced by clarity. Confusion starts being replaced by a sense of direction. And when you have a direction grounded in real biology rather than shame or frustration, real and lasting change becomes genuinely possible. That is what these conversations are for. If this video gave you something useful today, subscribe so you do not miss future discussions on metabolism, inflammation, longevity, and how the body actually functions over the long term. And if you are looking for a practical step by step way to begin implementing what we talked about today, the longevity guide linked in the description below was put together specifically to help you move from understanding these concepts to actually applying them day by day. Because understanding is only the beginning. The part that changes your health is what you do consistently afterward. I will see you in the next one.